So, our speaker today is Tanya Murphy from the Office for Citizens with Developmental Disabilities, or OCDD, and she is here to talk to us about Act 378, which is Individual and Family Support Services. So, Tanya, take it away. Thanks so much for being here. We appreciate your time.
Thanks for inviting me. It's my pleasure to do a little training here and there. So I will start with the Act 378, Individual and Family Support Services, is IFS is what we generally refer to it as. It's IFS services and the Flexible Family Fund service. Both are part of the Act 378. But today we're just going to focus on individual and family support services. And you might just hear me call it IFS because that's kind of like, I'll just go back to the acronym half the time. So Act 378 was passed in 1989 by a unanimous legislative vote. And it called for a plan for a system of community and family supports for people with intellectual and developmental disabilities, and including mental health and adult onset disabilities, which is run by OBH and OAAS. They have their own versions of the Act 378 programs. It also directed the DD Council to develop the plan based on the guiding principles that are located in the Act 378. And it asked them, the state, to actually implement the plan, and then the DD Council to oversee the implementation ongoingly. So the DD Council has been very involved in overseeing this program since 1989. I'm going to start with talking about those guiding principles. The intent of the IFS program is to meet the needs of individuals with intellectual and developmental disabilities, which exceed those normally met by existing resources. So existing resources can be entitlements, and those just occurring naturally in the individual's family and community. We don't want the IFS to supersede those programs that are already available to people through Medicaid, but we know that there are going to be some needs that exceed those already existing resources. The purpose of the IFS program, there's 4 of them. The first one is to establish and maintain and improve the quality of life for individuals with disabilities and their families. The second one is to link individuals and their families to the existing supports and resources, and then to supplement those supports as needed or as necessary. And the next one is to assist individuals with disabilities and their families to receive flexible supports, to consider the needs of the entire family, because families, as we all know, are best able to determine their own needs. And then the last one is to provide flexible services to meet unanticipated needs. Flexible, even though the other program's called Flexible Family Fund, this also is a program that tries to be as flexible as we can possibly make it. All right, who can request IFS services? You have to be a resident of Louisiana. The person has to have a current statement of approval or is currently eligible for early step services. Either one of those is one of the criteria to receive IFS. The individual or the family has to have a specific need that, if it's met, will help the person to remain in the community or can improve their quality of life. And the person could maybe institutionalize, but intends to return to the community with supports. All right, who can submit the request for IFS services? Any individual that has a developmental disability, their family or their representatives, a person's support coordinator or case manager can submit it. Or like if somebody's living in an institutional facility and they want to transition out, but they need maybe some IFS services to help supplement what's going to be occurring once they get out of there. The designated facility personnel for the person residing in that group home can submit a request for IFS services. That's honestly one that we very rarely receive, but it is in the guiding principles and the manual as far as who can request. All right, where are the requests sent? There are 10 human services districts and authorities across the state of Louisiana. Each one covers a specific region. And we also refer to those human services districts and authorities as local governing entities. You'll hear us talking about LGE this and LGE that. So in the vicinity of New Orleans, you've got Metropolitan Human Services District and Jefferson Parish Human Services Authority. But there are 10 across the state, and all 10 do administer this IFS program. So the IFS request is sent to the LGE that's administering that IFS program in the geographic location of the individual with intellectual and developmental disabilities. And I have to put in parentheses, there's some exceptions when you talk about people who are under guardianship and people who are in custody, people who are adults, but they're in a tutorship. It might change as to where the request is sent, but you would always just contact your local LGE and say, hey, I've got a need. Which LGE do I work with? And they'll help you. This is just a map I put up so that you can see the geographic locations that are covered by the 10 Human Service Districts and Authorities, or LGEs, and what they're all called. You know what? I didn't even start when I started this thing. I just jumped right into IFS, but I will tell you a little bit about me. As soon as I see this map, this is what makes me think of me. So my job is the liaison from OCDD to all 10 of the Human Service Districts and Authorities. And what that entails is my job is to try to make sure that these programs that are implemented by all 10 LGEs are done in a consistent fashion across the state, that everybody's following the policies and manuals. If the DD Council recommends some kind of update or change to the policy or manual, that's my job to edit the rules and the manuals, and then to provide the training to the LGEs so that everybody implements it the same. I got my start in Region 8, Northeast Delta. It wasn't called Northeast Delta at the time, but I started there for a couple of years in 1998. And then I transferred to Region 7, Northwest Louisiana, and worked there for maybe 13 or so years, and then transferred to Baton Rouge. Started out as the Children's Choice Waiver Program Manager, and then moved into this Regional Operations Director position where I'm at now. So I've got about 26 years experience with OCDD and have dabbled in like lots of different little programs. And so I thought maybe that would be interesting for you guys to know at least my background. All right. So now we know who can submit it and where it's submitted, but then what happens after your IFS request is received by the LGE? The LGE will assign the request to one of their staff, a community support professional is generally their title, and a plan of support will be completed with the applicant and their family. If the person has an active waiver, Medicaid waiver, then the support coordinator generally already has a plan of care put together, and we just make sure that the IFS request is incorporated into that plan. So the support coordinator help with that. But you will always have a community support professional at the LGE that will be your contact for those IFS requests. And then after the plan is put together with the family, where they talk about what is the need and how are we going to put it together, and is this something, how will this help you? How will we accomplish it? They put that all together with the request, and then they assign a priority to what that request is. And I'll talk about that on the next slide. And then the request itself is presented to the Individual and Family Support Committee. Every one of the LGEs has a committee that listens to all the IFS requests and makes a decision about about funding, and that's kind of what I'll be talking about in the next few slides. What are the priority levels? So your request is considered a priority 1 if the person needs services immediately to prevent out-of-home placements or homelessness. So you can see how that status of priority 1 is going to be requests that are very, very urgent. A priority 2 are supports that are needed to prevent the person with a disability's health from deteriorating, or to prevent the person from losing their independence, and or to maintain the caregiver's ability to provide the supports that they're already providing to that person. Are to maintain the person's health. And you can see as each priority gets different. Like if you see the priority 2 was to prevent the person from losing, and then priority 3 is to maintain the person's health and independence, and then priority 4 are to enhance the person's quality of life and enhance the family's ability. So priority 1, you're trying to keep the person from having an absolute urgent out-of-home crisis, and then 2 is to prevent them from losing, 3 is to maintain, and 4.
Looks like Tanya's having some connectivity problems. She told me that this could be an issue today. So if we have to pause for a moment, forgive us. She may need to log in one more time. Going to put you guys on hold for just a moment, but we are still here, okay?
Okay, I'm here. I was muted. I'm so sorry.
That's okay. Thank you.
Okay, so I'm going to stop my video because sometimes that pulls a little extra data and makes things worse. So can you let me know where I dropped out? Did I talk about priority 3 and 4?
I think you need to hit those again because you were going in and out at that point. So do 3 and 4 again.
Oh, that's my bad. Okay, so as we said in priority 2, it's the supports are needed to prevent the person's health from deteriorating. And then 3, supports are needed to maintain the person's health and independence. And then priority 4, supports are needed to enhance the person's quality of life and the family's. So you can see how the criteria continues to, it's similar, but the urgency is different. Okay, so I talked about the referral or the request being presented to the IFS committee. Who's on the committee? That's very specific. It's the DD director of each LGE or their designee, the individual and family support supervisor at each LGE, the support coordinator, the community support professional that's working directly with the person who's requested services. We have to have one representative from an advocacy organization like Families Helping Families. And we need a rep from the Regional Advisory Committee or the RAC. And we need one adult who is a parent or a participant who is receiving the services themselves. And they may serve a dual role. Like we might have an adult who's receiving or in the past has received IFS services, and they also are with Families Helping Families, or they also are on the RAC, and then they can serve a dual role on the committee. All right, what does the IFS committee decide? They discuss the request, and they have to take into consideration how much money the LGE has left in their budget for the year, and they can either approve the request in whole, they can approve it in part, they can approve pending funding, they can deny it outright, or they can defer it because there's not enough information and they need additional information to make a decision. And as I mentioned, or in parentheses on the slide, if it's denied or if it's approved in part, which means you asked for $3,000 and they only funded $2,000, you have appeal rights. If you didn't get the whole amount you asked for, or if it was denied outright, you have appeal rights. And also, just incidentally, the IFS committee can take the family's income into consideration when they're deciding on the priority level and when they're deciding on approval. So the person who's requesting services may be asked to submit their income to help with the decision making. All right, what happens next? The applicant or the family is notified of the IFS committee's decision. If they're approved, then the community support professional at the LGE will work with the applicant and the family to complete the agreement and pay for the request. And this, they're going to send you an agreement, which is, I always call it a contract, but it's an agreement, but it looks just like a contract, and it really lays out all the specifics of the request, and then everybody has to sign it. And then there's ongoing monitoring of services to make sure that the applicant or the family are actually receiving the needed services or the assistance that they asked for. What are some reasons that a request might be denied? One reason is that the service being asked for can be easily accessed from another source like Medicaid. It might be denied because the LGE is out of funds, or perhaps the documentation just is not adequate to substantiate a need. And I put an example, like if a family is asking for rent assistance, but they can't provide a notice that there's any rent due, or they can't substantiate that they actually have this need that they're asking for. Some more reasons that a request might be denied. The IFS funds cannot supersede funding of similar services. So, for example, if what's being requested can easily be paid for through state-funded Medicaid services, Medicaid waiver services that the person already has, if Early Steps provides it, if LRS provides it, Medicaid-funded behavioral health services, or your private health insurance. If all of these things could fund what the request is, then IFS is going to say, go try to get it from here first, because we only have a certain amount of money every fiscal year. And if you can get it for free or easily from someplace else, we want you to go and get it from there. And each LGE has their own unique community programs that they've developed. And so, there might be a request for incontinence supplies. And so in one region, IFS will pay for that. But in another region, they might have a deal worked out with somebody who gets that donated to them, and then the family can go and get it for free from there. It's unique to each LGE, and that's just another reason why things might be denied. Some examples of services that are requested: some equipment and supplies, some special nutrition, special clothing, respite, personal care attendant services, help with utility costs, some home modifications. And, these are just a couple of things I'm just throwing up there. It's not even close to all the possible services and things. We don't like to go to a family and say, here's a menu of things that we will buy for you. What do you want? We go to the family and find out what's going on in your world. What is it that's happening? How can we help this person with disability stay in the community and enhance their lives or prevent them from losing some independence? And is that not paid for by anybody else? Then individual and family support services can pay for it. And another part of the IFS program is ongoing monitoring. If the service is not a one-time purchase, for example, if you get like personal care attendant services and you're using a little bit of the agreement money every month and you're funded for the whole fiscal year, then they're going to quarterly check on you and make sure that the services are being provided You're going to be sending in monthly invoices. The LG is going to consistently look at the amount left in the agreement. If you're not spending the money, they may decrease the agreement so that they can send the money to somebody else that's asking for assistance. And the fiscal year, just for your knowledge, the fiscal year runs from July 1 to June 30th every year. The duration of the agreements. IFS agreements are either a one-time purchase or they're ongoing services. Ongoing services will typically end every fiscal year on June 30th. And then if services are still needed, then a new request has to be submitted for each fiscal year. And we'll talk a little tiny bit about appeals. If a request is denied or approved in part, the decision can be appealed. The appeal is submitted to the Division of Administrative Law when the individual or family gets the letter from the LGE letting them know the decision that the IFS committee has made. And if it's an appealable decision, then they're going to have the instructions in that letter how to appeal. And then after you submit your appeal to the DAL, then an appeal hearing is conducted, usually by phone. And then the Division of Administrative Law determines if the LGE followed our IFS policy in making the decisions that they made. Okay, so that's it. That's everything. Are there any questions from anyone?
Now's your chance, folks. You can either type your question into the chat box or you can open your mic and speak out. I know my family has used IFS services before for things that came up unexpectedly, and it's certainly has been wonderful to have that to fall back on. Heather asks, how do we find out what diagnosis qualifies for services?
That's a great question. So we don't, for the IFS program specifically, there's not a particular diagnosis that would or would not qualify. What you look for is if they have a statement of approval. So you would need to contact your local governing entity or your human service district and authority and find out if the person with that is suspected of having a disability, if they've never been through the system entry process and had that determination made, then that's where you would start. You would go through the system entry process. They'll determine if you've got a intellectual or developmental disability. And then once you get that SOA, then you can request your IFS. And so it doesn't matter what the diagnosis is. As long as you've got an intellectual developmental disability and you have an SOA, then you can make a request for IFS.
Let me interject here too, Tanya. I think a lot of young parents or parents of young children with disabilities haven't been in this long enough to know about talking with their local governing authority, to get on the list for services. If you know that your child has a developmental disability, or if you suspect that they have a developmental disability, you need to call your local human services authority or district and tell them that and talk with them about how to start getting services, because services are so varied. There's so many different things that you can access. You don't just get pummeled with all the stuff that you have to take. You can do what's best for your family, but there are services available for families of children with developmental disabilities that are very beneficial. So I encourage you, if you've not done that already, to go ahead and contact your human services district or authority. We do have that information, and I can send that list to you, or a link to the list of the 10 that you had on the screen earlier, and let everyone know who they need to contact for their parish to do that. I have another question. Could you explain the reason for this act? IFSP is actually something different. Tanya, you want to?
Yeah, sure. So I talk about the SOA a lot because that's after a child turns 3, they get the statement of approval. But prior to that, if you're in early steps, then you would have an IFSP, which is the plan that the early steps program makes.
It's kind of like the
So that's what
IEP of early steps.
exactly. Yeah. So if you're eligible for early steps, you could make an IFS request. And so the question of why was this created? So it was back in 1989 that it was a group of people who wanted a system of community and family supports for people with intellectual and developmental disabilities. Um, and they said, we've got some guiding principles. We want to see some money set aside to help people with intellectual developmental disabilities. And I don't know personally how far back the Medicaid waivers date, but I would guess that this act was created to provide some services prior to or right around the time as those DD waivers were also created. So at the time, there may not have been supports in the community for people with intellectual and developmental disabilities. And, it could be that people were put into institutional settings quite a bit at that time. And so this was an act that the legislators um, passed unanimously to provide some support to people so that they could continue living in the community with their families.
I apologize, Kelly, because I wasn't even putting the IFS services and the IFSP together. I'm sorry. I see acronyms and I'm very
Oh,
compartmentalized, but I just realized the confusion. So I apologize for that.
yeah, IFS, individual and family support. So that's not the acronym for this program.
Right.
Right. IFSP is something in early steps. So, okay. Thanks for catching that.
I will be sending out like I said, the list of the human services districts and authorities for you. If I can find a copy of Act 378, I'll send that as well. I think I have it on the wall at the at the office. Um, but I will find that and send that as well if I can. And it's always good if you can, when you're learning these things. I know if you take any of our webinars, if you sit in on any of our webinars and we're talking about IDEA or we're talking about this bulletin or that bulletin, it's always best to go straight back to the horse's mouth. Go to the source and read it for yourself. They're not quite as intimidating as you may think they are. And especially with IDEA, the Individuals with Disabilities Education Act, it's long, but there are so many different websites you can go to help you just look at certain parts of it that will be beneficial. So it's always good to go back to exactly what the law or exactly what the act says. Yes, louisianabelieves.com is our State Department of Education website, and they have all that stuff on there. Lots of all the bulletins, all of I think they have links to IDEA. They have links to find IEP forms. I mean, there's just a ton of information on that website as well for education things. Any other questions related to um, individual and family support services? Tanya, this has been very thorough and very informative. So thank you so much for doing this.
You're very welcome. Thanks for inviting me.
Kelly, did you have a question? You're muted if you're talking to us. There you
I
go.
was I was just showing a visual. My son is actually listening to the
Awesome.
webinar with me. So usually I don't, we're in the car. So in a parking lot.
What's your son's name?
Zachary.
Hey, Zachary.
Zach, say hi. Oh, well, maybe not.
Well, thanks for joining us. We appreciate it.
Thank you.
All right, folks. Well, if we don't have any other questions, oh, I need to put the survey in the chat. Y'all, I was just getting into the conversation and just totally forgot about it. So please don't leave without our survey because we do need these to help us to stay in business and keep these things going for you. So let me copy that real quick and drop it in the chat box. So before you go, click on this link. Also, if you need a certificate of attendance for today, fill out that the survey and the link that I just put in the chat box. There is a place for you to request a certificate, and I usually send those out on Friday for the ones that happened this week. So you'll be getting that in a couple days. If you have any other questions, I will be sending you the slide deck with your follow-up email. Tanya's contact information is here should you need anything specific to her. First thing would be to contact your local governing authority, though, your Jefferson Parish Human Services Authority or your Metropolitan Human Services District, whichever one, from whatever parish you're in. That would be your first thing is to contact them. But if you have any questions that can't be answered, contact me or Tanya. Tanya, thanks for your time and we appreciate it. Hope you have a great afternoon. Thank everybody also for working through those little tech issues with us. We had our fingers crossed that we were gonna go smoothly, and we appreciate it, Tanya. Thanks so much.
Yes, thank you so much.